if you know you're having multiple partners, to use protection, right? So we try to, employ these women and them in the health centers and stuff like that to get tested, know your status, because there's a window when you get pregnant. The first 4 months is critical. So once you know your status, you can go on your ARV. Once you're positive, you go and you take your medication, which will help you from spreading the virus onto your unborn child. Right?
Well, this is incredible information, because what it suggests is that all of the campaigns of educating people, they're actually working.
Yes.
Okay.
Yes. Some, because if you go to some places, to be honest, and people still doesn't have a good knowledge on HIV. Because when we hold, when people invite us to like health fairs, you find I will do a questionnaire and terms and question them their knowledge on HIV. And sometimes it's like 18 little questions, and people get like 6 and 7 wrong because they realize they still have misconception where HIV is concerned.
But you were able to make that critical intervention, that 4 month period.
Yeah.
Okay. So that means that the fewer children are being born with HIV.
Yes.
But the danger is still there, and that's the main focus of your work.
Yes.
Okay. Tell us about that. How can mothers, after the child is born, even if the child is born without HIV/AIDS, how can she still pose a risk to that child?
She can pose a risk if she breastfeeds that baby, because you can transmit the virus through breast milk. But what is discovered, World Health Organization did a review on infant feeding, and they say now that mothers who are HIV positive can breastfeed, but the only reason she can do that is if both mother and child is on ARVs. And she has
ARVs
retroviral, right? That's the medication. And they would she would have to exclusively breastfeed for 12 months, which is a whole year, exclusively. No partial feeding, no infant formula, anything like that.
Okay.
That's really so, but it's not actually enforced here yet, because we still tell people do not breastfeed.
Okay.
And
these antiretrovirals, they're widely available?
Yes, they get it at MRF, which is, normally with the Queen's Park Savannah right there.
Yeah.
They go and they get their meds. So they have to be on the meds. There's a regime. Now, the thing is, people get confused and tell themselves that because people are HIV, they have to take this whole barrage of medication, which they don't. It's like basically 2 tablets. It all depends on what the doctor prescribes, and they have to take it like once for the day. So
but that was for the early days when they had just introduced these drugs, and you had to take a tablet the size of Flintstones.
Yes.
But things have evolved since then.
Yes.
But it does require some discipline on the part of
Yes, discipline, and going to get your regular checkups, knowing where your viral load stands. Because, if you don't do that, then you pose things up, so you expose your immune system to actually getting full-blown AIDS, because people are living longer with HIV.
But that's one of the problems. These women, many of whom are single parents, it's difficult for them to be as disciplined as they ought to be, because of the circumstances in which they find themselves. They're often unemployed, they're raising these children on their own, and that places a...
Yes, that's so true, because I had a client. She was living in abject poverty. Her house was run down. We networked with ITNAC, and they got a foreign crew that was here to build houses, which was Campus Crusades for Christ. And they went up and tried to, fix the home, make it a little more secure, because when we went to do the house visit, it wasn't secure enough, and she had girls. So, okay, they did that. But then she went into depression and refused to take her medicine. No matter how we tried to reach her, she's now dead, and he left behind 3 children, And we still try to liaise with the children. We talk with them. We didn't just throw them in the bamboo. They are still part of mothers to mothers. So we look out for them, in terms of food stuff, making sure they go to school and stuff.
What is the health of these children?
Oh, they are healthy. They are not HIV positive. Yeah.
One of the challenges, as you mentioned, people are living longer because of the availability of these medications and the effectiveness of these medications. But that does also mean that these people are living longer with HIV. It means that they have to be more disciplined in the context of their sexual behavior. That must be another challenge.
It is. Because of the stigma and discrimination that they face, some women are afraid to disclose their status to their male partners. So that's a bit challenging for us right now, because they're going and having unprotected sex with these men, and they're not telling them their status, which is basically wrong. But I know the reason why, because of the rejection they're going to get and how people view them. And then we still at a place where, to be honest, if you know, people tend to go on already, say, she have AIDS, she have AIDS. And to get away from that, they prefer not to say, which is wrong. So we're trying to get them to a place to feel comfortable. They're living with a virus, and feel comfortable enough to share, without fear, but they're still living in that fear.
Does your organization have the resources to provide support for the children in the context of their lives and going to school and living with, unfortunately, the stigma of discrimination, which does still exist? Because these children not only have to be healthy physically, but mentally, and they have to be supported. And children, unfortunately, can be cruel, and they will face that kind of discrimination in school.
Well, so far, I haven't had the privilege of engaging with children thus far, because most of our mothers who deal with children are not positive.
Okay.
So they are in normal schools, they are doing well.
No, I meant discrimination because their parents.
Yeah, well, Lorna had faced that, actually, when she went to get her children.
And
Lorna Hamilton Henry. Okay. She's the vice chair. She's the person who came up with the idea of having mothers to mothers in Trinidad and Tobago.
Right.
She said she faced that issue because she was HIV. They were giving her problems to take the child in school, even preschool, as much as preschool. She had a fight, because the children have HIV, but they weren't positive. Right. But people don't see that, so they tend to discriminate and they don't want the children in school. So she had to take up that mantle and fight for all other mothers whose HIV. There's no discrimination, you know what I mean? Yeah. And even I trained with Cyrilus because I'm doing my degree at Custard, and I did my training in Cyrilus. And most of the kids there are in normal schools, but the principal and them don't know who they are.
But given all of the prevailing discrimination, how then do you find these people to give them the support that they need?
To be honest, people refer them to us. Yeah, we have social